So let's discuss about what exactly is the course of facial nerve like. Okay. So if we say facial nerve, what is facial nerve? Facial nerve is a seventh cranial nerve, and it is a mixed cranial nerve. That means it has got a sensory as well as a motor root. Now the facial nerve course starts right in the pons and it finishes in the parotid gland. So it is from P to P, that is pons to parotid. When I say facial nerve, it has got two nucleus which are important for motor function and two nucleus which are important for sensory function. So it has got two motor nucleus which are efferent where the roots go out, two nucleus which are afferent where the sensations come back to the pons and they are for sensory functions or for understanding where the sensation is coming from. Okay, so two efferent, two afferent. Now what are these nucleus? Let's see that. The four nucleus of the facial nerve are SVE, GVE, SVA and GSA. अब ये सबसे इंपॉर्टेंट, सबसे कंफ्यूजिंग होता है कि ये है क्या, राइट? अब सबसे इंपॉर्टेंट देखो, two above nucleus what are present here, these are the motor nucleus of facial nerve, and two nucleus that are given below here, these are the sensory nucleus of facial nerve. Okay. Now when we say motor nucleus, मतलब ये efferent होंगे, right? So there are two types of efferent fibers. अब इसको याद करने का तरीका, what is the best thing that you do very special? Special चीज आप में क्या है? Special चीज humans में है space बनाना, facial expression बनाना. So just exactly special visceral efferent. Visceral का मतलब organ, efferent का मतलब fiber that is going out, motor. Special, जो special चीज करा रहा है. What will be that? The special visceral efferent fibers give supply to facial muscles of expression. Facial muscles of expression. That is what these SVE fibers are supplying. Okay, fine. What is the supply of general visceral efferent? Generally हम लोग क्या करते हैं? Generally या तो हम खाते हैं या फिर रोते हैं, right? So I understand कि GVE मतलब general. General हम क्या करते हैं? General either we do salivation or we do lacrimation. So what is the supply that is given by general visceral efferent? General visceral efferent gives its supply for salivation, for salivatory fibers, and lacrimatory fibers provide lacrimation. That are the two functions for GVE. Now let's come to what is afferent. अब afferent में क्या है? What is special visceral efferent? क्या हमारे चीज में special है? जो क्या हमारी sensation है? Which is very special to us. The best and most special sensation to us that is afferent is actually taste. So taste sensation carriers, जो taste आ रहा है हमारे अंदर, that is something which is carried by the special visceral afferent fibers, right? And finally we have got general somatic afferent. Generally हमारे afferent fibers कौन से sensation generally आते हैं? Painful. So pain sensation is from the GSA fibers. So SVE facial expression, GVE lacrimation salivation, SVA afferent is for taste sensations, and GSA generally क्या होता है, कहां से sensation आती है, that is for pain sensations. These are the four nucleus of the facial nerve. We are going to trace each and every nucleus, each and every fiber by the help of a diagram, right? चलो अब हम लोग एक एक segment देखते हैं. Now this is what here what I have done is I have already drawn a cross section of the whole course of the facial nerve. How will it be? So this is the topographical way in which I explain facial nerve. मतलब this is something I have cut open a man like this in the sagittal plane. This is sagittal plane. I've cut open and you are seeing me from the lateral aspect. आप दूसरे side से आप देख रहे हैं. So what you're seeing, this is the cut section of the head. You can see the mouth, the mandible, the maxilla, the orbit, right? You can see the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Behind in the posterior cranial fossa, you can also see the brainstem, which has got the midbrain, pons, and medulla. Behind the pons, you can even see the fourth ventricle. Right? This shape over here, this is your fourth ventricle. This is your fourth ventricle. Right? Okay? So this is what we are understanding about the diagram, right? This is your anterior cranial fossa, middle cranial fossa, this is posterior cranial fossa. In the posterior cranial fossa, you can see here, this is your internal acoustic meatus, because this is a very important meatus through which the facial nerve will pass. So I've drawn the internal acoustic meatus. In the middle cranial fossa, I've drawn foramen lacerum. This is foramen lacerum. Okay. Now, what else can you see over here? This is called as a middle ear box, the same middle ear box which we have read in our anatomy lectures. So this is the same middle ear here. Okay. Behind the middle ear is what? Now imagine, I've cut open like this. Up अंदर देख रहे हो. So that means the tympanic membrane has been removed. That means you are seeing the inside of the middle ear. This is the medial wall of the middle ear. What you are seeing over here, because the lateral wall has been removed. So medial wall, you can see the promontory, right? And you can see this window above, posterior superiorly, this is oval window, and posterior inferiorly is your round window. That's what we have learnt in our anatomy also, correct? Now, what is this wall? This is the anterior wall, and this is the posterior wall of the middle ear, okay? On the posterior wall of middle ear, you see this projection which is there. This is called as pyramid. Pyramid is a projection in the posterior wall of middle ear. And anterior to the anterior wall of middle ear, what is there? Anterior to the anterior wall of middle ear is the internal carotid artery. That is why the anterior wall of middle ear is also given the name as carotid wall. So you have got the internal carotid artery over here, around which there are certain nerves. I'm going to come later, but there are certain sympathetic nerves around the internal carotid artery. Okay, fine. Then obviously you've got the tongue, you've got mandible, you've got maxilla, and there is a fossa which I have drawn over here. This fossa is called as pterygopalatine fossa. Pterygopalatine fossa is what? It is a fossa which is present behind the posterior wall of maxilla. So you can see this is the maxilla, this is the posterior wall of maxilla. Behind the posterior wall of maxilla is pterygopalatine fossa, and it is in front of the pterygoid plate. So this is your pterygoid plate. So the small fossa, which is like an inverted fossa, which is present between the posterior wall of maxilla and the pterygoid plate, this is your pterygopalatine fossa. Okay, now let's go one by one. This is what the cross section is all about. अब हम एक-एक करके एक-एक fiber देखते हैं. The first fiber that I told you for facial nerve, I'm drawing it in orange color, and this is your SVE fibers or special visceral efferent fibers. I told you special क्या है हमारे में? The special visceral efferent fibers are motor fibers, we know that, and these are basically the fibers which are supplying the facial muscles of expression. Facial muscles of expression. That is what they are supplying, right? So I'm going to first trace on these fibers. Now, there is a nucleus of SVE which is present over in the pons, right? Every nucleus of the facial nerve is in the pons. That's why it starts in the pons, ends into the parotid. Now, these fibers, what do? There is another nucleus present here which is called as sixth nerve nucleus or abducent nucleus, जो होता है pons में, right? Now, before exiting out, what happens is the fibers of the motor nucleus come out, they turn around the sixth nerve nucleus, and then they create a bulge in the fourth ventricle. You can see they are turning around the sixth nerve nucleus and they are causing a bulge in the fourth ventricle. This bulge that is created in the fourth ventricle is called as facial colliculus. That is called as facial colliculus. The facial colliculus is a bulge created by the motor fibers of the facial nerve in the fourth ventricle. Now they exit out from the junction between the pons and medulla, that is pontomedullary junction, and they go inside into the internal acoustic meatus. Okay, so motor fibers start from the pons, turn around the sixth nerve nucleus, come at the pontomedullary junction and just enter the internal acoustic meatus. Till here, till this course from the pons till the internal acoustic meatus, the part of the facial nerve is called as intracranial segment. This is called as intracranial part. Okay, that is the first part of our facial nerve. Now, once these fibers enter inside the internal acoustic meatus, they will become intratemporal. That means now they have entered inside into the temporal bone. Okay, now the first part, once it enters inside the temporal bone, will go into the internal acoustic meatus. This is called as meatal part. That means inside intratemporal, first it was intracranial, once it enters into the intratemporal, the first part inside the intratemporal is the meatal segment or the intrameatal part. Then once it comes out of the meatus, it goes towards the roof of the middle ear and then takes a turn. Now once it is turning, it forms a ganglion over here. What is ganglion? Ganglion is a collection of cell bodies outside the central nervous system. So that is called as ganglion. So now this exits out of the meatus and goes up till the roof of the middle ear and forms a ganglion. This ganglion which the facial nerve is forming at the roof of the middle ear, this is called as geniculate ganglion. This is called as geniculate ganglion. Okay, now once this geniculate ganglion, the facial nerve will go from the internal acoustic meatus till the point of geniculate ganglion. This segment of the facial nerve is called as labyrinthine segment. This is the second segment under intratemporal, which is called as labyrinthine segment. Okay, now it forms a ganglion that is called as geniculate ganglion. Now after geniculate ganglion, it turns. And this turn produced after the geniculate ganglion, this is called as first genu. First genu matlab bend. So now it will turn towards the roof of the middle ear and this is called as first genu. Now this facial nerve from the geniculate ganglion will come down and it will go behind the pyramid. It will come down behind the pyramid. Okay. Now, once it is descending down, it will actually descend down between two structures. One is the oval window and the other is the lateral semicircular canal. So, lateral semicircular canal and oval window ke beech mein, it will actually come down behind the pyramid. This is the point where it actually turns the second time between the lateral semicircular canal and the oval window. And when it is turning the second time, this area is called as second genu. The second genu is present at the junction between the lateral semicircular canal and the oval window where it is turning the second time. This is called as second genu or second bend. And then it is coming behind the pyramid. The part of the facial nerve that is present between the geniculate ganglion up till the pyramid, this part is called as horizontal part or tympanic segment of facial nerve. So this is called as horizontal part or tympanic segment of facial nerve. So what have I done? Intracranial course up till internal acoustic meatus, then comes intrameatal part, from the meatus till geniculate ganglion, labyrinthine part, from the geniculate ganglion till the pyramid, horizontal या tympanic part. Right? Now, after the pyramid, then this particular facial nerve will come out and it will come out through a foramen called as stylo-mastoid foramen. Ab stylo-mastoid matlab styloid or mastoid ke beech mein. So you can see behind the middle ear is your mastoid process. This is your mastoid and there is styloid. There is a foramen just next to them. This is called as stylo-mastoid foramen. Correct? And this facial nerve is exit out of the temporal bone through the stylo-mastoid foramen. So from the pyramid up till the area of stylo-mastoid foramen, this is vertical. So this segment is called as vertical segment of facial nerve. Simple. So intratemporal part is again divided into four segments. One inside the meatus called as intrameatal part. From the meatus till the geniculate ganglion called as labyrinthine part. From the geniculate ganglion till the pyramid called as tympanic or horizontal part. And from the pyramid up till the stylo-mastoid foramen called as vertical part. Okay? So we have done intracranial part and four segments inside intratemporal part. Now once it comes out into the extracranial part, matlab ab bahar aa gayi hai, through the stylo-mastoid foramen it has come out, it will go inside a gland which is called as parotid gland. It will go inside a gland which is called as parotid gland. And it will exit out through the parotid gland between the superficial lobe and deep lobe of the parotid. Parotid ke do lobe hote hain, superficial lobe and deep lobe, and this nerve will exit out between them and then it will divide into important 5 branches. It will divide into 5 branches. So what are the important branches of the motor nucleus of the facial nerve is my question, right? So what exactly, this is the whole course, what we have seen, intracranial part, intratemporal part, 4 segments, and when it comes out into the extracranial part, it goes into the parotid, right? Now, once this muscle, cut again the last part again. Now, once this nerve has entered inside into the parotid gland, right, it will exit out from the anterior margin of parotid and it will divide into 5 branches. And what are the 5 branches over on the face? The 5 branches over on the face are temporal branch, zygomatic branch, buccal branch, marginal mandibular branch and cervical branch. These are the 5 branches which are present over on the face. Now this arrangement that is present of facial nerve fibers over the face, this is called as pes anserinus, or we also call it as goose feet arrangement. Goose feet arrangement. These are the extracranial divisions of the facial nerve which have gone and formed 5 branches over the face. Now not only it will give fibers to 5 branches over the face, the extracranial part will also supply stylohyoid muscle. Stylohyoid is present over the styloid process and it will also provide important branch to the posterior belly of digastric. So it will also supply the posterior belly of digastric which is present over the mastoid process which attaches to the mastoid and the stylohyoid muscle which attaches over to the styloid process. Okay, so these are the various branches which the extracranial part is giving. Extracranial is giving the 5 branches of the face. It is giving stylohyoid branch and it is also giving its branch to the posterior belly of digastric, right? Now, one more branch is given by this important vertical segment of these motor fibers. And what is the vertical segment of motor fibers going to give? The vertical fibers usually give a branch and that is called as nerve of Stapedius. Nerve of Stapedius means this is a nerve which is supplying the Stapedius muscle and this is the nerve which is very much important for our stapedial reflex. That whenever we hear a loud sound, this is the nerve which gets activated and it pulls the stapes away from the oval window, right? So nerve to Stapedius is the branch which is given off from the vertical segment of the facial nerve. This is the only branch of the motor fibers which is given inside the middle ear. That is also an important question. Okay, fine. So what is nerve of Stapedius? It is given by the vertical branches of the facial nerve, which is inside the middle ear, the only branch which is present inside. Rest all are extracranial branches. Intracranially, facial nerve doesn't have a branch. Okay, fine. Now we finish off the importance of the motor fibers, right? So it is gone into in providing supply to the muscles of expression, right? That's what we have read. And what are the related pathways and what are the related branches? Now we come on to the next important nucleus of facial nerve, and I told you the next thing that is there is about something which is general. So that is general visceral efferent, and general visceral efferent is obviously having something related to lacrimation and something related to salivation, because I told you the mnemonic that या तो हम रोते हैं और या फिर खाते हैं. So salivation and lacrimation, that is generally that we do. So we need to trace the fibers to the lacrimatory pathway, and we need to trace the fibers to the salivatory pathway. Okay. Now first we'll trace lacrimation कैसे होगा, फिर हम salivation देखेंगे. So first we'll start from the same thing. So there is a nucleus, this pink colored nucleus, this is a GVE nucleus, but the GVE fibers do not cross over like motor fibers. They directly come out of the pontomedullary junction and they enter inside into the internal acoustic meatus. This is the same pathway what the motor fibers are following. See, if the facial nerve completely follows the same course, all the fibers will be together, right? They are all together in one sheath, but I'm showing you these fibers so that you can remember what are their functions. Now these fibers, GVE fibers, in the same way will go to this ganglion, which is the geniculate ganglion, right? The same labyrinthine segment. Every fiber has the same segment. Remember that, right? They are all together. Now they will go to the geniculate ganglion. Now at the geniculate ganglion, like the motor fibers were relaying at the geniculate ganglion, these fibers do not relay. ये रिले नहीं करते. मोटर फाइबर्स रिलेड एट जेनिकुलेट गैंग्लियन. उन्होंने बातें करी. They were pre-ganglionic before the geniculate ganglion, then they became post-ganglionic. But these fibers will not relay at the geniculate ganglion. The first branch that will be given at the level of the geniculate ganglion from the GVE fibers will be called as greater superficial petrosal nerve. So remember, what is the first branch given at the geniculate ganglion of the GVE fibers? That is GSPN, or greater superficial petrosal nerve, which is the branch of facial nerve GVE fibers, right? And it is given at the level of geniculate ganglion. It is not relaying here, it is giving a branch. Now this greater superficial petrosal nerve will go into the foramen lacerum. But the problem is, this foramen lacerum has got no opening below. That means foramen lacerum is closed by a cartilage below. Always remember, foramen lacerum, nothing passes through and through. It is closed from below by a cartilaginous sheet. Okay, so these GVE fibers will enter through GSPN here, and you know GSPN, or greater superficial petrosal nerve, is parasympathetic. So this is a parasympathetic nerve. Now nothing in our body can run only parasympathetic. We need even a sympathetic nerve with it. So what happens? There is another nerve that is present. I drew for you, that is present around the internal carotid artery. And any artery has got nerves around them which are sympathetic. So these are sympathetic nerves around the internal carotid artery. And these nerves will now go and join the GSPN in the foramen lacerum. This is called as deep petrosal nerve. So deep petrosal nerve are the sympathetic fibers of the internal carotid artery. Greater superficial petrosal nerve are the fibers which are coming from the geniculate ganglion. When these both fibers meet, the GSPN, which are parasympathetic, and the deep petrosal, which are sympathetic, they form one single trunk inside. They form one single trunk inside. And this trunk together of the deep petrosal and greater superficial petrosal nerve, this is called as Vidian nerve. This is called as Vidian nerve. So what is Vidian nerve? This is a very important question. Vidian nerve is a nerve which is made up of parasympathetic fibers of GSPN and the sympathetic fibers of the deep petrosal nerve. They are together called as Vidian nerve. Now I told you that the foramen lacerum is closed from below. So they need a canal so that they can go into the pterygopalatine fossa, because you see that this canal is going into the pterygopalatine fossa and it is between the foramen lacerum. So it is connecting the foramen lacerum to the pterygopalatine fossa. So this canal is called as pterygoid canal. This is called as pterygoid canal, which links the foramen lacerum to the pterygopalatine fossa. Now inside this pterygopalatine fossa is a ganglion which is called as pterygopalatine ganglion for obvious reasons, right? Now this pterygopalatine ganglion, what will it do? Till now these fibers have not relayed. I told you they have not relayed. They are still pre-ganglionic. They have not relayed at the geniculate ganglion. So now these fibers will go and meet into the pterygopalatine fossa. Pterygopalatine fossa will have this pterygopalatine ganglion. Pterygopalatine ganglion will now make these fibers post-ganglionic. So now once after relay, these fibers will now go up and they will enter into the inferior orbital fissure. This is our inferior orbital fissure. This is our orbit. And they will supply the lacrimal gland. They will also go and supply certain nasal glands. And that is why, because of these fibers are going to the lacrimal gland and the nasal gland, we experience lacrimation because our gland gets stimulated. So lacrimation is a feature of these GSPN as well as these deep petrosal fibers which are becoming postganglionic, and whenever they get stimulated, we start lacrimating. Did you guys understand, right? What is the lacrimation process? So you will be asked that lacrimation is produced by which branch of the facial nerve? You have to answer it is because of GSPN, or the greater superficial petrosal nerve, which is a branch given off at the level of the geniculate ganglion. Okay, fine. This finishes about what is our lacrimation pathway for GVE, right? Now we come to SV cut, again the last part. Now we come to the salivation fibers, right? How are we salivating? Salivation happens from sublingual and submandibular salivary glands. So what will happen? Now, what will happen is, now not all the fibers will go and form this GSPN. Some of the fibers of the GVE will travel the same way as the motor fibers are traveling with them. They'll form the second genu, they will come up till the pyramid. But they will not come as a vertical part down. They will not go as motor fibers into the extracranial part. As soon as these GVE fibers, the remaining fibers, some of the fibers went and formed lacrimation. Salivation, what happened? The salivatory fibers followed the motor fibers till the pyramid, and then at the level of the pyramid, they come towards the anterior wall, they cross over to the anterior wall, and they come out through a canal, and this canal is called as anterior canaliculus. This is called as anterior canaliculus, which is a small space or an opening present in the anterior wall of the middle ear. And they cross over to the opposite side, and what do? They go straight up and supply the submandibular as well as the sublingual gland ganglion. So now what do? They cross over to the anterior wall of the middle ear, where this opening is present, called as anterior canaliculus. Ye bahar aayenge, and they will go towards what ganglion? They will go towards a ganglion called as submandibular ganglion. And here they will relay, because these fibers have not relayed at the geniculate ganglion. जैसे pterygopalatine ganglion में relay किया था GSPN ने, these fibers of salivation will relay at this submandibular ganglion, and they will give supply to the submandibular and sublingual glands, which will produce saliva. So I told you that in the GVE segment, the lacrimation happens once the fibers come into the intracranial to the intratemporal meatal segment. They go up till the level of geniculate ganglion. Here they will split. Lacrimation ke fibers will form the GSPN. It will go into the foramen lacerum, meet the deep petrosal nerve, form Vidian nerve, relay at the pterygopalatine ganglion, and then will supply the lacrimation as well as the nasal glands. What will happen to the salivatory fibers? They will come after the geniculate ganglion with the motor fibers at the level of the pyramid. They will cross over to the opposite side, exit out through the anterior canaliculus, and they will go and relay at the submandibular ganglion, which will supply the submandibular and sublingual glands, which will form saliva. This is what is the whole idea behind how you lacrimate and how you salivate. These are the GVE fibers. ठीक है, चलो अब आते हैं third important पे. Third I am making in white in color. Third is, let's finish GSA. That is simple. That is the pain fiber. Pain मतलब general somatic afferent. कहां से आता है? I told you in the beginning in your anatomy lectures, the GSA, that means the pain that is produced by the facial nerve usually occurs around the conchal region. I told you, put your hand inside the concha, that is 7 and 10, right? So around the conchal region is the fibers where facial nerve usually supplies, and even the facial nerve is supplying the posterior superior part of your external auditory canal. So what will happen? The part of the pinna around the concha, that area, and the posterior superior part of your external auditory canal, if they get any lesion like a blister, right, or any boil, if they get stimulated, these fibers will carry the sensations from there. They will be ulta, right? So they will carry the sensations from that area. They will relay at the geniculate ganglion. यहाँ पे relay करेंगे, and then they will go ulta in the same way, forming the labyrinthine part, forming the meatal segment, and then go into the pons. And here they will relay into a nucleus, and this nucleus is the nucleus for GSA. This is also called as spinal nucleus of trigeminal nerve, because trigeminal nerve is a nerve which is related to pain sensations. So facial nerve is also sharing another nucleus with trigeminal nerve called as the spinal nucleus of trigeminal nerve, which usually causes these sensations to be, you get to know about these sensations when the facial nerve gets stimulated. Okay, so the GSA nucleus is what? It is the nucleus of trigeminal nerve, or the spinal nucleus of trigeminal nerve, which will experience pain sensations. Where will it go from? It will go from the posterior superior part of the external auditory canal and the concha. Simple. ठीक है? अब आ जाते हैं लास्ट पे, लास्ट टाइप ऑफ फाइबर्स. लास्ट चीज हमारे लिए स्पेशल क्या होती है? सो I am going to draw this in green color. So the best thing that is most special to us, special visceral afferent, is taste sensation. We taste by a nerve called as chorda tympani. So again, an important question. Chorda tympani is a branch of facial nerve. Chorda tympani carries taste sensation from, it carries the taste sensation from the anterior 2/3 of the tongue. Okay, so now what will happen? From the anterior 2/3 of the tongue, the chorda tympani fibers will go, right? And they will go in the same direction as the salivatory fibers came. उसी direction में जाएंगे. They will cross inside through the anterior canaliculus in the same way, come towards the opposite side. They will come in the same direction, follow the pathway, form the second genu, go above, relay at the geniculate ganglion, go back, enter inside into the internal acoustic meatus, and then they will go inside into the brainstem, into a nucleus which is called as nucleus of tractus solitarius. So what is the nucleus for SVA fibers? It is nucleus of tractus solitarius. बस यहां पे क्या करना है? The whole pathway is ulta. Afferent में ulta pathway. They are both relaying at the geniculate ganglion. दोनों GSA fibers as well as SVA fibers. So here they start at the anterior 2/3 of the tongue. They go back. They enter inside the middle ear through the anterior canaliculus, cross over to the opposite side, ascend up, form the second genu, form the first genu, then become the labyrinthine segment, go into the meatus, and then they relay into a nucleus called as nucleus of tractus solitarius. That's all. That finishes the whole course of facial nerve and all the 4 fibers which have been asked to you as questions. Okay, now एक question इसमें हमेशा आता है that inside this temporal bone, are these fibers just open like this? So intracranially they are all under one sheath. ये एक sheath है जिसके अंदर ये चारों फाइबर है intracranially. But inside the temporal bone, are they covered? Yes, they are covered inside the temporal bone also. So the canal or the bone inside which they are present, all these fibers, there is a bone above them. There's a bone above all these fibers which are covering it. And the bone or the canal inside which these fibers travel, that is called as fallopian canal. So fallopian canal is the bony canal inside the temporal bone in which the whole of the facial nerve runs. It is not, this fallopian canal is not there intracranially. It's not extracranial. It's only inside the temporal bone when this whole nerve is traveling. So it's inside the temporal bone. It has to be inside a canal, and that canal of the facial nerve is called as fallopian canal. Okay, fine. So now I'll tell you the potential questions which have been asked as it is in your paper. So I told you that your whole facial nerve is divided into intracranial part, intratemporal part, and extracranial part. Right? I'm going to concentrate upon the intratemporal part here, क्योंकि ये सबसे important है. I told you that the intratemporal is divided into meatal segment, labyrinthine segment, horizontally a tympanic segment, and then comes the vertical segment. This is what I told you, right? These are the 4 segments we have seen. Now, what is the length? It's something important. Meatus ka segment is around 8 millimeters in length, right? So you can see here, this is the meatal segment. This is around 8 millimeters. Right? What is the length of the labyrinthine segment? Make it half of meatus. So labyrinthine segment is around 4 millimeters. Labyrinthine segment is around 4 millimeters in length. This is 4 millimeters. Now remember one important part. They will ask you which is the shortest segment of facial nerve. It has to be labyrinthine क्योंकि ये सबसे छोटा होता है around 4 millimeters. Also, this is the narrowest segment of the facial nerve. It is only around 0.64 to 0.68 millimeters in width. 0.64 to 0.68 millimeters. So it is the narrowest segment. So if they ask you because it is the narrowest and the shortest segment, which is the commonest segment to get involved in any case of facial disorders, जैसे कि Bell's palsy, the maximum cases which happen is because of the compression of labyrinthine segment. So Bell's palsy में और Ramsey Hunt syndrome में any particular condition where facial palsy is occurring, the most common segment to get involved is the shortest as well as the narrowest segment, which is the labyrinthine segment. Okay. Now comes the tympanic segment. Tympanic segment is around 11 millimeters and vertical is around 13 millimeters. Okay. Tympanic segment is the most common segment for congenital dehiscence. Yeah, as it is पूछा जाता है. So this segment, the tympanic segment after the geniculate ganglion till the pyramid, that segment could be dehiscent. Dehiscent का मतलब हो सकता है इसके ऊपर से fallopian canal गायब हो, bone नहीं हो. That is called as congenital dehiscence. So most common congenital dehiscence is seen in which segment? It is seen in your tympanic segment. That is the most important question. And finally comes your questions from vertical segment. Vertical segment matlab seedha from the pyramid up till the stylo-mastoid foramen. Vertical segment is the most common segment to get injured most commonly by iatrogenic injury. Iatrogenic matlab during mastoidectomy. Okay, so that is the most common area to get injured causing iatrogenic palsy. Okay, so there are two things which can get injured when we drill. See, when we are drilling mastoid, right? So we can drill and we can injure this area, right? The vertical segment. So if I ask you which is the most common cause of iatrogenic palsy, so it is the injury to the second genu. This turn which is happening between the lateral semicircular canal and the oval window is the most common site for iatrogenic palsy. Second most common site is the vertical part of facial nerve. So two things where during mastoidectomy we can injure the facial nerve. Most common, or the first most common, is the turn where it is happening between the oval window and lateral semicircular canal, which is the most common area, or the second genu is the most common area for iatrogenic facial palsy. I've written over here first most common area, second genu. Second most common area still remains the vertical segment of the facial nerve. Okay, fine. Now, what is the supply? The meatal part and the labyrinthine part both get supplied by labyrinthine artery. Okay. Horizontal part gets supplied by superior petrosal artery, and the vertical part gets its supply from stylo-mastoid artery because it comes out of the stylo-mastoid foramen. So that is stylo-mastoid artery. These are all the questions that have been asked regarding the course of facial nerve. Okay, fine.